Ajagbe. We welcome you now.
Okay. Well, good afternoon, everybody. I'm in BC, Canada right now. I'm a general practitioner back from home. I'm just I'm really excited to be here. Initially, I told Marie I'm not an expert on this area. I'm not a psychiatrist yet, neither am I a geriatrician, because that is basically the area of the expert. But eventually, I was convinced. I said, okay, maybe I will share my personal experience. And that is what I'm bringing to the table today, because sometimes they say experience is the best teacher. From the medical school and doing my postgraduate as well, I've read so many things about general medical stuff and different things. But it's absolutely different when it comes to having a personal experience, especially working in a facility that are full of elderly people with dementia. It's a total ball game. And that is what I'm gonna share today. Initially I was like, oh, am I gonna okay. I First of all, I think I need to acknowledge people that are present. Dr. Daniel, that was a wonderful presentation. Thank you very much. I'm very excited about Dr. Sarah. Dr. Sarah used to be my instructor, Dr. Family, Mr. Gary from Family Moving Forward, and the wonderful moderator, Mr. Terry Morgan. I hope I pronounced it well. Marie, I want to appreciate you so much. I want to appreciate your children and the audience. Without the audience, we won't be here. And I pray that by God Almighty, we'll be able to provide adequate information and education, just like Dr. Daniel Thomas have said, especially in the faith community, because people need to know. People will need to know actually what is happening. I'm so glad that Dr. Daniel have given a very robust, clear, comprehensive understanding about what is happening medically when it comes to Alzheimer disease. Okay, next slide. So I have just decided to make my presentation so short, few slides, but I will be sharing more of my experience. Just to touch a little bit, Dr. Daniel have said it before, Alzheimer disease, it's represents like almost 90% out of the dementia, and is one of the major dementia disease. It's one of the commonest when it comes to dementia. It's a major neurocognitive disorder, and it's characterized by progressive memory impairment with other signs and symptoms that Dr. Daniel have said. I'm going to be pointing some later on. The next, yes, this is, I just, when I saw this picture, I said, okay, this absolutely depicts a lot of things when it comes to Alzheimer's disease. We can see that woman, an elderly woman, like just sitting down there. I'm going to be describing the 5 A's that are so pathognomic of Alzheimer's disease. The first A, but first of all, before I go to the A, there are 3 important things that's very common. I've seen it. With my personal experience, with elderly people, especially after 70 years, that have basically been diagnosed, they have that medical diagnosis as Alzheimer's disease. Their judgment is impaired, concentration is impaired, and of course, the attention. So going to the 5 A's, first of all, medically, there's a term called amnesia. That is memory loss. And Alzheimer disease, a patient with, or a resident or a client with Alzheimer disease, it's just and elderly people like me and you. There's nothing so particular about it. It's just that the problem that has to do with memory loss. Somebody actually said it's because, well, the hippocampus, which we know is responsible for the memory, is overfull, and there are lots of also also reasons. Some people, some theories say that it's genetic. Some people say it's familiar, different stuff. So one major important thing is an Alzheimer patient have memory loss. And sometimes they just lose their personality. Who am I? They don't know who they are anymore. And when we see that, it's not their fault. It's just what is happening at the level of the brain. The second thing is anomia. That is inability to remember names of things. If we look at that diagram, we see that elderly woman holding a shoe. To her, is holding a shoe, but he wants to write something. I mean, like somebody that does not have clear understanding of Alzheimer's disease. Oh, what are you doing, mommy? What are you doing, daddy? But that is what she couldn't in her mind. She thinks that shoe is a pen, but whereas it's not. So we just have to. I'm gonna say the do's and don'ts. That's how we can be able to navigate our way when we come to our seniors or elderly people that are experiencing some of these signs and symptoms I'm describing. So the next thing is apraxia. So apraxia, basically the misuse of objects because of failure to identify them. They can't identify the objects, they can call. Let me see, I'm trying to scan my brain, particular. I've seen in the facility I worked for like a year, which I will say I didn't take the role of a medical doctor there, but as a clinical supervisor, because I really wanted to know what the nurses do, what the care does, and I want to have a personal relationship with some of these elderly. So I have seen residents that just sometimes just because they don't remember the name of what a particular thing is, they can like sometimes like, okay, maybe forget what's the name of the wristwatch. They can forget, just mix a lot of things up, and that could be very annoying sometimes. It just take a very caring, patient care provider or healthcare professional to be able to know what is happening at the brain at that time. The fourth A is that their inability to recognize familiar objects, taste, sound, and other what's this now? Okay, other I think that's under sensation. I'm not seeing it clearly. So this could be very, very discouraging. I have seen a family member coming to, okay, the sensations. That was what I was trying to say. Like inability to recognize familiar faces. I have had it, like many family coming to me. I'm like, oh my God, my mom does not recognize me anymore. I mean, like giving a phone to a resident, to an elderly person, and they say, asking the son, oh, and the son say, for example, maybe the son say, oh, I am Jack, just hypothetically, and say, oh, who are you? I don't know you. That could be very, very cause a lot of psychological, emotional distress, especially to the family members. As a mom, you don't know me, blah, 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 blah. And that is one particular thing, some particular way. And sometimes like, even like, let's just say, like that picture as is depicting. Can you just imagine somebody putting a flower pot on her head and it thought maybe it's a ribbon, but it's not. And maybe eventually putting on the pot, before you know it, the flower pot is on the floor. The whoever that is taking care of them have to start cleaning the floor, have to start doing all the personal things that's the different mess that have happened as a result of the impairment that is happening at the level of the brain. Then
Dr. Ajagbe, could we see a little bit more? We are Seeing just a partial area of your face. Could we see a little bit more? Just pull up the camera a little bit more. We're
Oh, the
enjoying your
camera is on.
presentation.
The camera is on. I'm not seeing myself. I'm seeing you.
Okay. All right.
Okay.
Continue. Continue.
Okay, can you see me now?
Okay. Continue. Continue.
Or maybe I should adjust. What about that? Is
Yes,
that
that's
okay?
perfect. That's perfect.
Okay. So the other here is aphasia, inability of someone to express herself through speech. Sometimes like talking to them, somebody having Alzheimer, like you might just, it's because they're already losing their words. You might tell them like, okay, I want you to do this. Can you come with me? Their response is different. And sometimes they don't have the word to articulate what is in their mind. And that could be very, very distressing, you know, to, to family members or to the caregivers, because they can't express themselves anymore. And sometimes if at the extreme end, it might at the extreme end, it might get to the stage that they cannot even say anything. You just, it's just talking to like somebody that is completely flat. With dads, like somebody, maybe a mom or a dad you're talking to, you have a very beautiful relationship with, but now you cannot discuss close things, important things. You cannot run to mom, or if it is a dad, you cannot run to them again just for advice or just for mom to dad relationship, which I think all of us cherish so well. So there are so many signs and symptoms, but I just, when I saw this picture, it's one of my friends, I just pick it, I say, oh, this just say, it's going to say a lot of things that I want to say. I have seen a case sometimes like maybe in the senior home, like you can just see the elderly person just being restless. Okay, oh, I'm going upstairs. Yeah, what are you going to do upstairs? Oh, I have an office there. It's confused, especially in the evening when they're having sundowning. Like, okay, even like going to, because absolutely they have regrets. Sometimes when at the extreme stage, they, like, you can be looking at a 70-year-old or 80-year-old, they have absolutely regressed. I think we'll be talking more about the psychological impact of it, which I think it's what everybody wants to know. I don't want to go into the medical stuff so much, so it doesn't bore us that much. They are practically regressed to like a 6, 7 years old. Some of them, they have lost some of the activity, daily living, some of the functions. Some of them, they've even, it could be as bad as they don't even remember how to wear their shoe, how to put on the clothes, how to use the washroom, how to use the toilet. That's why many people, that's why it's so important that, the nurses and the caregivers who is taking care of them, especially those of us that are people in the senior homes. Oh my God, I really respect nurses so much. I respect the caregivers. They are doing so much, because you have to have that special skill. First of all, you have to have the fear of God. I'm a born again Christian. I can't deny Christ in my life. So you have to have that passion. You have to have that genuine. First of all, I think the passion, then the understanding, the knowledge, the skill, to know that this person is different from who that person used to be. So I just have to take it the way it is. And before I move to the next slide, I think there are, from my experience, the do's and the don'ts I would like to share. Like, please, let me go for the don'ts first. It's not in this slide, but I'm going to share it. Never argue with an Alzheimer patient. Please don't. If you're arguing with them, you're just gonna you're gonna get frustrated, and you're gonna make them frustrated. For instance, like maybe like I will share a particular scenario that's okay. Oh, this is funny. I remember a particular elderly woman after eating the dinner, and he said that, oh, and the son called and he said, oh my God, I've not eaten since morning. It's coming. And the son like, oh, really? My mom has not eaten. What the heck? After, oh, she just finished eating. But she said she has not eaten. The son get upset. Okay. Oh, really? You the first thing to do, don't argue with them because they've forgotten that they have eaten. So what do we do? Just flow along. Okay, you have not eaten, that's fine. Okay, maybe you need more food. You find out that by the time you give them the food, they may not be able to eat because they're already full. Not until the particular case I'm discussing. Okay, now come at the social time, your mom is eating right now. Okay, call after 1 hour. I've not eaten my dinner. Wow, really? He said, Mommy, you have eaten dinner. No, I know. It's just because they are forgotten. They are not lying. This might come in different ways. I'm talking about relationship now. You know, that shouldn't make us like get upset with them that they are not lying. It's just what it is. Like in Canada, we say it is what it is. It's just what we have to work along with. Never to argue with somebody having dementia, somebody having Alzheimer disease. So one of the most important things that I have done and I have seen is that just like I think I said this earlier, flow along with them. Oh, you might see a dementia patient like, okay, maybe they might even, well, maybe they want to like, I don't know, this might be the extreme. They might want to, they might see a river, they want to jump into it. Oh, really? You want to jump into the river? Don't argue with them. Okay. I think that would be nice. Okay, maybe we should jump into it together. So just flow along with them and slowly with a low tone, high tone, redirect them. They can easily be redirected. But the moment an Alzheimer patient see, just an example, see yellow to be red, and you say, no, it's not yellow, it's red. You are frustrating the person. It's just gonna get agitated, and at the end of the day, you're gonna get agitated, then there won't be anything. You're not gonna make any positive thing out of it. Just flow along with them and use a loving low tone. Maybe I did some of psychotherapy. They used to call it like therapeutic tone, or just a low tone, and to just redirect them. As long as they are within their bubble, to keep them safe and they are okay. So that is it. With this, I'll use my next slide. There are so many things. There are so many things that Alzheimer disease can cause in the patient themselves, and also especially the caregivers. I'm laying emphasis on that. One of the things, what I've seen, what I've heard, depression and anxiety. The second thing, I just picked these two specifically because if I want to talk about depression, I'm sure I can talk about depression and anxiety for hours. But under this, where I purposely picked this because the rate is so high in Canada. And apart from that, I find out that about 22 other diseases, chronic conditions are attached to this particular, these two major bullet points that I put on this slide, which is depression and anxiety and obesity. When I'm talking about depression, we know some of the, according to the DSM-5, so many early signs of it, like just find yourself having mood swings, depressed mood, loss of interest, altered sleep, guilt, because sometimes I find even like some family members are full of sense of guilt, especially women. Women have special way of caring. Men care so much as well, but sometimes you see like a woman just have this sense of guilt. I'm not doing enough for my mom. No, you find yourself, that might be an early sign of depression. You do it, it's just that you are not skilled enough to take care of them. You might have to take a lot of education concerning them. It's not something one have to be worried about. Although they say it's an irreversible, being a Christian, there's nothing impossible when you're talking about scripture. There's nothing impossible when it comes to God. But it's one of the things that could be very challenging. And when we come to there are some so many caregivers as well, when they are stressed, and like normal stress is okay, but when it's stress now become very chronic and it leads to release of cortisol in the body, this is one of the things that lead to a lot of medical conditions like coronary artery disease, stroke, diabetes, which is on top of the game, hypertension, gallbladder disease, sleep apnea, just to mention few. I know that Dr. Zara is here, Gary is here, Mary is here. They're going to talk more about a lot of psychological impacts that caregivers can face, and even these residents or patients or clients that suffering from Alzheimer's disease also experience. So I think the key thing is understanding. So let me just go to the next slide. So I was like, okay, it's good to have an understanding of it. I purposely chose this particular diagram because when I searched the Health Canada, Diabetes Canada. So, and I find out, you're not talking about nutrition, but it's part of it. I just want to provide a few solutions. What I'm gonna dive more, especially if we see the bottom part of that pyramid, like I just find out that, oh my God, this is absolutely an holistic approach. If you look at the first figure, we can see, well, for one to experience wellness, they need to be balanced between the spiritual, the mind, and the body. Excellent. So we look at the first figure, like, okay, this is the time, as if you have someone that's suffering from Alzheimer's disease, or you're taking care of an Alzheimer's disease, you need that quiet time. On the faith, I would say meditation, that no matter what, don't overburden yourself, because caregivers or whoever that have relatives suffering from Alzheimer can go through a lot of emotional and psychological stress. So the second part is connection. Don't do it alone. You need that connection. The connection is absolutely remarkable. I want to quote Dr. Sarah here. I remember I used to do my thing, and she said one thing in the class. She said one of she said that all the problem in the world is due to relationship. I will never forget that statement, because one is it a relationship. I look at it medically with my medical background, like relationship within your body. Is your brain functioning well in line with your kidney? Is it functioning well in line with your liver? Whenever there is no balance, no homeostasis, then we have dysregulation. That is when one thing or the other, either failing or one thing or the other. So connection, like the first connection with God, connection with your creator, that moment of meditation for oneself. The second part, you need to connect with others. Then when it comes to family as well, connecting with the community, connecting with families, you need to have that time to recharge your battery if you're taking care of someone suffering from dementia or Alzheimer's disease. And okay, thank you. I see the time. So exercise is one of it. I'm sure Mary is going to talk more about self-care. So, and of course, because some of the sign of depression is that people, they tend to overcome the stress and they get into, they don't know what to do. It's just eating, using food to quench the stress. But eventually what that leads to can be overweight and obesity. And I mentioned in few, a lot of chronic medical conditions that could come as a result of that. So that is why I basically use that picture. I'm so glad I'm rounding up my presentation right now. Thank you all for listening. It's a pleasure to be able to share some of my experience. So thank you so much.